the TNM classification of the esophageal cancer. So T state is first the T status. So if there is high grade dysplasia, then the esophageal carcinoma is the TIS, mean the carcinoma in situ. Okay, so the high grade dysplasia will be TIS. Then if the cancer invade the lamina propria, muscularis mucosa or submucosa, then it will be T1 at the T1 stage. Okay, lamina propria, muscularis mucosa or submucosa, then it will be T1. Then T2, if the carcinoma invades into muscularis propria, then it will be T2. Okay, T2. Then T3, invasion into adventitia. Okay, invasion into adventitia, then it will be T3. Okay, this is the T3, it also invade the adventitia. Then T4A and T4B. T4A invade the resectable adjacent structure, for example pleura, pericardium or diaphragm. So the T4A, it invades the resectable adjacent structures like pleura, okay, or diaphragm, or it can also invades the pericardium. Then T4B, it invades unresectable structures, adjacent structures like aorta, vertebral body and trachea. Then the N status, lymph node status of the esophageal carcinoma, if there is no metastasis to the regional lymph nodes, then it is N0. Then if there is one or two lymph nodes involved, then it is N1. Okay, if there is 3 to 6 positive lymph nodes, then this will be N2, and 7 or more positive renal lymph nodes will be N3. Okay, this is the N classification or N status. Then the M status, metastasis. So when there is no distance metastasis, it is M0, and the distance metastasis, like in this picture it is in the liver distance metastasis, then it is M1. Okay, then according to the histological grading, G1 will be well differentiated, G2 moderately differentiated, G3 poorly differentiated, and G4 is undifferentiated. Okay, so this is the TNM classification and histological grading of the esophageal carcinoma.